Maybe you've been told you have shoulder bursitis, tendonitis, tendinosis, shoulder impingement. Maybe you have a report that says that you have a rotator cuff tear. But you already knew that because every time you roll over in bed, you reach for something, you move a certain way, and it grabs you and it reminds you of your bad shoulder. In this video, I'm going to show you my favorite stretches and exercises that can help your shoulder pain. Stay tuned. How can you fix your stubborn shoulder pain? My name is Dr. John Saunders, and I've been in clinical practice for over 18 years. Many people suffer from shoulder pain. The shoulder joint is a fairly complex joint. It sacrifices stability for mobility, and with that, it is easily injured. If you know someone that's suffering from shoulder pain, this might be a video you want to share with them. One thing to keep in mind as well, if you do not know your diagnosis, please speak to your healthcare provider to make sure the exercises and stretches are appropriate for you. One other thing to note is sometimes your shoulder pain may not be coming from your shoulder at all. It might in fact be coming from your neck. If you have neck stiffness or neck pain with your shoulder pain, you might want to have someone explore the neck as the cause of your shoulder pain. There's a video up here that can give you some tips on how to treat shoulder pain that's coming from your neck. Fixing your shoulder pain can be frustrating. As you probably know, it takes a long time. There are a few reasons why your shoulder might not be healing as fast as you'd like. One of the things that prevents your shoulder from healing is you continue to re-injure it or aggravate it with certain movements. Now, trying to avoid those reaches that cause that sharp pain is essential to you healing. Another reason why your shoulder pain might be stubborn is you're probably sleeping on your injured shoulder. This is one thing you have to try to avoid if you want your shoulder to heal. Try to stay off it at night. Another thing that prevents shoulders from healing in a reasonable amount of time is that as we age, the blood flow changes to the tissues. So because of that reason, we need to have some patience and persistence through these exercises and stretches. And one last thing before I show you these stretches and exercises is you need to be aware of your posture. The fact of the matter is that we're sitting more than we've ever sat. Our shoulders will rotate internally and it will cause some impingement or encroachment. It stretches some of the tissues. It causes a change in the length of the muscles and tendons. All of these things create a situation where your shoulder will be stubborn and take much longer to heal. So be aware of your posture. Get up, move around, pull your shoulder blades back, watch your head posture when you're doing these exercises, and they'll become more effective for you. Let's start with a simple stretch, the cross-body stretch. What we're going to do is we're going to take our arm and we're going to pull horizontally across our body. We're going to hold this stretch for 15 to 30 seconds. And we can do this about 3 to 4 times. You can do this multiple times a day as well to create some increased range of motion in your shoulder joint. The second stretch we're going to do is stretching out the front of our chest or the pec muscles. For this, we need a corner or an edge of a wall, a door frame, and all we're going to do is we're going to pull away so we can feel the front part of our shoulder, elongating and opening up that chest. Again, you can hold this one for 15 to 30 seconds, 3 to 4 times a day. For this next stretch, we're going to be lying on our side, so it's good to have a pillow to support your neck. We always want to make sure we're aware of our posture when we're doing any of these stretches and exercises. For this one, we're going to lie on our side comfortably, get our arm up at 90 degrees. This is the affected side, so the sore shoulder is the side you're going to do, but you could do both to keep things balanced. And we're just going to rest our head, give some support, and we're going to drop our arm internally rotated, and we can take our opposite hand and just place a little bit of pressure, downward pressure, to increase the stretch. This stretch, you should not push into pain. A little bit discomfort or tightness is okay, but you definitely don't want to push and irritate your shoulder. This one you can hold again for up to 30 seconds, and you can rest, and then again, we'll come up, drop it down, and just a little bit of downward pressure. It's a really good stretch. You'll feel it really deep in your shoulder. If you haven't been following along so far, I encourage you to do it so you can feel the stretch as I walk you through some of these neck stretches and exercises. This next stretch is one of my favorites. It's a traction stretch or a decompression stretch. Very simple. We need to grab either the inside of a door frame, a handle with a door closed. The first thing we're going to do is we're going to bend at our knees and our hips, not our lower back, and we're just going to lean away, tractioning our shoulder this way. So you can do it one arm, again, be aware of the lower back, or you can come to the center and do two arms. You want to visualize your shoulder joint being stretched. You can do this stretch 3 to 4 times a day, multiple times a day, holding it for a minimum of 15 to 30 seconds. You can also change the height. You can actually grab above and try different angles, and you'll find the one that feels the best. Again, remember, don't push or pull into pain with these stretches, but you can push or pull into a bit of tightness or very slight discomfort. Let's get into a little bit of mobility now. This one's a very simple exercise, shoulder rolls. We're gonna basically do front shoulder rolls and back shoulder rolls. We wanna make sure that our chest is up, our head is up, and we just go through full range of motion. Nice and slow, 10 one way, and then we go back 10 the other way. You might hear a little bit of clicking or cracking or crepitus. It's okay as long as it's not painful. So we want to do 10 one way, 10 the other way. We can do this 2 to 3 times a day as well. It warms up the tissue and gets the shoulders moving. Okay, for the next one, we're going to do shoulder pendulum. Shoulder pendulum, we want to make sure we bend over, don't roll your back. We want to get our affected shoulder, and all we're going to do is do 2 planes of movement. We're just going to get the shoulder moving in the joint, back and forth, or sorry, front to back. 10 in each direction is good to start, and then we'll do horizontal, 10 in each direction as well. And then we can turn this into circles. We'll do one way, about 10 circles, and then we'll do the opposite. For some of you, the biggest thing we want to make sure is that we're not rounding through our back, that we're holding our back in good position. We're bracing ourselves, maybe with the other arm on the knee, and again, we're visualizing our shoulder going through a nice range of motion, increasing the mobility in the joint. For some of you, you could add a little bit of weight. We've got a soup can here. You could have a small weight. It could be anything to just add a little bit of resistance. See, I'm rounding my back and I don't want to do that, so we want to actually keep a nice flat back. Rest our arm on our knee with good form and just go back and forth 10 times in each direction. 10 rotations one way and 10 the other way. You can do this 2 to 3 sets a few times a day to keep that shoulder moving. Okay, moving on to wall crawls. This is a very good exercise if you experience any stiffness, frozen shoulder. It really gets you moving the shoulder joint without really having to activate the muscles. We're gonna do both from the side and from the front. I'm gonna try to explain this because of the view I'm showing you here might be difficult for you to see. Let's start with the side. There's a few things you need to keep in mind. You want to crawl up the wall with your fingers, trying not to activate the muscles, but to get the shoulder joint to move through its range of motion. What we don't want to see as we're crawling, we don't want to see a hike. We want to keep our shoulder blade, our shoulder in place as we crawl up the wall. When you get up to the wall, you don't want to pull it off either because you're going to activate those muscles. So let's start low. We're going to crawl up. We're not hiking our shoulder, we can keep it low. You're gonna crawl up until it starts to get stiff or painful, and you're gonna hold that for 10 or 15 seconds. And you're gonna try to crawl up a little bit higher. This should be a progressive exercise over a period of a few weeks. As your range of motion increases, you should be able to get higher and higher without hiking your shoulder. And again, we don't wanna pull off, we want to crawl back down, really focusing on the range of motion in our shoulder joint. I'm going to show you the front now from the back, and I want you to really watch my shoulder. We're going to start low, we're going to come up. We don't want to hike our shoulder, keep that down, and if you can only go a certain amount, that's okay. And then hold that position for 10 to 15 seconds. Try to crawl up a little higher, and again, don't hike your shoulder up. Keep it as low as possible. And then when you're done, you're gonna crawl back down all the way to the bottom and keep the shoulder nice and relaxed through that whole motion. We can do this 3 sets from the front and the side. And remember, crawl up and crawl down. You want to visualize the shoulder moving inside the joint versus trying to cheat your way up the wall. The next exercise is internal and external rotation. A few tips with this. This one you can do with a TheraBand, or you could do this very effectively isometrically. And all that would mean is finding a wall and taking your arm, and we're going to externally rotate into the wall. We want to be about 80% of your max effort here, or pushing into about a 4 out of 10 in terms of the intensity of discomfort. So 0 is no pain, 10 being the worst you can imagine. You want to push into about 4, maybe 5 tops, but at 80% of your max effort. You're gonna hold this for about 15 to 30 seconds, 3 to 4 sets, and alternatively the same thing is internal rotation. You can do this against your belly if you'd like, or you can use the opposite arm at 90 degrees. I like this, it's simple. Just push in, again, you're rotating in, you're pushing into your belly. Hold this 15 to 30 seconds, 3 to 4 times, and this can easily be done multiple times a day. Alternatively, if you find that one effective, then stick to that isometric. But if you find you want more motion while you're doing the exercise, then we'll do a dynamic exercise. For this one, you're gonna need a TheraBand, some tubing, something to provide some resistance. Another tip for this one is I like to have a face cloth or a towel, something to hold. The reason being is when we're doing this, oftentimes people will try to cheat, not purposely, but they'll try to bring their arm off of their side. We want to keep this secured while we're doing this exercise. So we're going to push in, pull in, and we're going to grab our TheraBand 90 degrees, take a few steps out so we can get some resistance there, and we're going to externally rotate as far as you can in terms of full range of motion. If you can only go here, then that's okay. Just go to your full range of motion. Again, not pushing into discomfort. Don't push into pain, but a little bit of stiffness or tightness is probably okay. And again, we're gonna do this 3 sets on each side or the affected side, anywhere between 10 to 15 and even up to 20 repetitions. And the same would be if we do internal rotation. Again, hold a towel, something to keep your arms secure, take a few steps off the wall, and we're going to internally rotate. Try to keep your shoulders back, your head out over top of your shoulders. Always be cognizant of your posture, whether you're doing a fitness exercise. Posture is important so that you don't injure yourself, and you train your body to maintain good posture while doing these exercises. This next exercise, we don't need any equipment, just our hands. This is called the push-pull. For the first part, we're gonna do the push part. We're gonna come in prayer stance, and we're gonna come down as far as we can, and we're gonna activate and push our hands together. And as we do that, we're going to move our hands either in a circular motion, a back and forth motion, or a side to side motion. You can pick which one works best for you, which one you prefer. Be creative. So we're gonna start in the lower position first, and we're gonna do 10 circles or 10 sides to side. Then we're gonna come to the middle. Again, we're pushing, activating those muscles. They're gonna get really warm when you do this, 10 times on each way. And then we'll come up to the high position. Again, activate 10 maybe circles one way, then the other way. Or if you're doing alternative movements like this, same thing. You can do that for 3 sets, whether you decide 10 circles, 10 front backs, or side to side. In each position, it will be effective in activating those muscles. Now the opposite is the pull. So we can pull, clasp your hands together. Again, we can go circles this way. Let's stick with the circles today. 10 this way. I don't think I'm doing 10 here, but for demonstration purposes, just to get through this. And then we'll do in the middle, we're pulling. Again, you're gonna feel this one. This one you might actually even break a sweat. And then at the top, we'll go 10 one way, and then 10 the other way. And you really feel the muscles activating and getting really warm. It really helps promote healing of that chronic recurring shoulder issue. On to cheerleaders. You're gonna need a TheraBand or tubing for this one. Again, one of my favorite ones. We're gonna come straight out in front of us. We're gonna retract and depress our shoulders. We wanna keep our shoulder blades down and contracted. And all we're gonna do is this one you can really feel. Do this 3 sets of 5 in the front, and then we go, yeah, I can definitely feel this, really good. 5 in this direction, and then we'll go again, pull the shoulders down, pull them back, and then 5 in the other position. So we have 5 horizontal or to the middle, 5 one direction, 5 the other direction. Again, pull your shoulders back, try to hold them down and really contract those muscles. My shoulders are burning right now. I'm sure yours are too if you're following along. It's just a great exercise for mobility and strength of your shoulders. Side planks. Side planks are a great stability exercise, obviously for our core, but we often forget they also are a fantastic stability exercise for our shoulders. So for some of you that have mild discomfort, you'll be able to do the full side plank. For others, you might only be able to just have your body weight leaning on your shoulder and holding this be anywhere between 15 seconds to start. Start with 15-second hold, work up to 30, 45, 60, even up to 90 seconds. If this is manageable just on your elbow like this, then we can get up on our knees. We want to again make sure that our posture is okay when we're doing this. And finally, for those that can manage or work up to, then we can get into the full side plank position. Don't do this on a bench like me, you know, you could fall off, but get in the position. You'll feel in your shoulder, all around your shoulder blade. It's a great stability exercise, not only for your core, but for your shoulder joint as well. The best way to approach your shoulder rehab is to walk through those stretches and exercise with me. Get a good grasp on what feels good, what feels bad, the ones you enjoyed the most. Put together a routine for you. Do them at least 4 to 5 times a week. Be persistent. Try not to get frustrated. And I know that if you do this consistently, your shoulder pain will improve. If you like this video and like content like this, I'd really appreciate it, a thumbs up. If you're new to my channel and haven't subscribed, maybe you'll consider subscribing to show me some support. As always, if you have questions, leave them in the comments below. I love answering your questions and communicating with you through the comments section. Thank you again for tuning in, and I can't wait to see you on my next video. Stay well.